This evening with that breaking news. Good evening. Thanks for being with us. I'm Jennifer Bellamy.
And I'm Faith Jesse. The CDC advisory panel voted unanimously to recommend that only people in certain groups should get the COVID-19 vaccine. So this new recommendation, it includes people 65 and up and those with underlying health conditions. This would mean everyone else would need to consult with their doctors. Acting CDC Director Jim O'Neill would still have to approve this. Separately, the CDC Advisory Committee decided to not proceed with this new guideline requiring prescriptions to get the shot after a 6-6 vote less than 2 hours ago. 11 Alive's Grace King explains how that decision could affect you.
This meeting of the Advisory Committee on Immunization Practices was anything but normal. An August attack on headquarters moved the two-day discussion to the CDC's Chambly campus instead, with a group of 12 newly appointed members.
We normally see rolling membership, so there's historical knowledge at all times, and having a clean sweep of a new group is a little disconcerting. Some of them have been in one meeting, and some are now, new ones have joined.
Dr. Jody Guest is a senior vice chair in the epidemiology department at Emory University's Rollins School of Public Health, keeping a close eye on the votes ACIP takes this week.
It is important that we are always examining new information about safety and efficacy, and that's what this group has always done, made sure they're following the best evidence.
But on Friday, the group seemed split on what information they trusted.
What would it take for us to acknowledge that there is a problem?
Science supports the COVID-19 vaccine works.
In a 6-6 votes, the ACIP decided not to require prescriptions before anyone gets the shot.
This group of people is very serious about the decisions that are at stake, and we're going to take all the time needed.
Dr. Guest says that'll help those without primary care doctors or time keep their right to choose.
We have the choice to choose if we get a flu vaccine or not. We want that same level of choice for our COVID vaccines because it's about individual risk and other people that you're around.
In Atlanta, Grace King, 11 Alive News.
Now, these recommendations are not final. Acting CDC Director Jim O'Neill will get the final decision. However, they are very similar to the limitations already put in place by the FDA this summer.